The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The greatest wealth is our own health. Good evening and welcome, dear friends. This is Meenakshi Sharma, back again with yet another new episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. In this talk show, we have highly qualified and expert doctors from different medical backgrounds to share their valuable knowledge and details on various health topics so that our viewers can get maximum benefit out of it, because your good health is our primary concern. Dear viewers, hypertension is one of the most widespread disease in many countries. It is the most modifiable risk factor for coronary heart disease. It causes stroke, then it causes heart failure and end-stage renal disease. It is found mostly in diabetic and hyperlipidemia patients. High blood pressure is a silent killer and it can strike without any warning. So dear viewers, to throw more light on today's topic of discussion, that is chronic disease and hypertension, we have with us in our studio Dr. Bushra Al-Sharaf from Al Hilal Hospital, Salmabad branch. She is having 22 years of experience as a family medicine consultant, and also she is having 4 years of experience as a medical director, out of which 2 years with Al Hilal Hospital, Salmabad branch. So let's welcome her. Good evening, Dr. Bushra. How are you? And welcome to our show.
Good evening, and thank you very much for this interview. I'm very glad to speak about one of the chronic diseases and a very important topic, which is hypertension.
Yes. So doctor, to begin with, as we know that hypertension is a very serious disease, as just now I mentioned. So to begin with, we would like to know what exactly is hypertension and what is the prevalence of hypertension in general population.
Actually, hypertension, it is classified according to the reading of the systolic and diastolic blood pressures. When the systolic blood pressure is 140 and diastolic blood pressure is more than 90%, so it is considered as a diagnosis for the hypertension. And in the more, we will speak about the grading according to the reading. It is one of chronic diseases which affecting the person, and it will be a lifelong persisting diseases that can cause complications in all organs. That's why it is one of the most priorities of the all health centers, how to give a big health promotions to avoid of having hypertension cases. The prevalence of hypertension, it is quite high, as in Bahrain, the national non-communicable diseases that Bahrain have about 16.3% of the populations with a hypertension. And in general populations, they have about 30 to 45% of a hypertension. And there is also a lot of studies have been comparing according to the lifestyle of the patients, they can have a hypertension more. Like in India, they have a very good study to be comparing about the patients who are living in a rural and urban area, and there was a really significant differences in the patients who are having a high blood pressures between these two areas. And the patients who are also persons who have a very high income, like in Canada, Australia, and the UK, they have a low percent of having a hypertension cases. But in other countries which they are having a low income with a diet high in salt and fats, like in Dominica or in Iraq, they have about 48% of the populations they can have hypertensive cases.
Okay, okay. So what are the guidelines for measurement of blood pressure?
Actually, measuring blood pressures is a very important because it is the beginning of diagnosis of the blood pressures. So we begin with the posture of the patients. Even if the patient is at home, he wants to be measuring his blood pressure. So at the hospital, it should be in a two sitting, supine and sitting, and the patient should be sitting comfortably, and the head should be supported, as well as the arm should be at the level of the heart levels. The cuff of the blood pressure measurement is very important, that it should be covered at least about 80% of the arms, and it should not be too tight or too loose, because it can give a wrong reading and a wrong diagnosis.
Okay, okay, that is very important.
And one of the importance is also the patients, before measuring his blood pressure, they should stop at least 30 minutes of smoking, alcohol, and exercise as well.
Okay, okay. That is very good information that you have shared about the blood pressure.
Yes, especially for the patients who are before they are diagnostic as hypertension cases and they are following up their blood pressure at home. It's very important, especially to checking the machine, even the batteries. It can affect all the readings of their blood pressures.
Yes. So what is the grading and diagnosis of hypertension?
We have 3 grades for diagnosis of blood pressures. We have grade 1, and it is according to the reading of a blood pressure. It is when the systolic blood pressure is between 140 and 149, and diastolic blood pressures is between 90 and 99. And with these readings, it should be diagnostic within 1 month and starting of the medications. The second grade, which is a grade 2, that the systolic blood pressure, it is between 160 to 179, and diastolic blood pressure is between 100 and 109, and it should be diagnostic within 2 weeks. And the grade 3, when the systolic blood pressure is more than 180 and diastolic blood pressure is more than 110, and diagnosis should be only within 1 week.
Okay. Okay. So what are the risk factors of hypertension and what are its causes?
Risk factors, they are a very long list, especially nowadays with our lifestyle has been changed. We will start with the obesity and overweights, with food, fast foods, high in salt, high in fats, as well as lack of exercise, being inactive with sedentary life. Smoking, alcohol is again a strong risk factor to have a hypertension and with a positive family history.
Okay, okay. So one has to be very careful regarding their blood pressure and they should regularly keep a check on that.
Especially if they have a risk factors, yes, because hypertension called the silent killer, and it is one of the common causes of coronary heart diseases, heart failure, and a sudden death. So we should keep an eye on blood pressure.
Yes. Because are there any symptoms of hypertension that one
Not
should
all
know?
of the cases they can have symptoms. Somebody can walk to the clinics and they have a very high blood pressures without any symptoms, and they be shocked that when their blood pressure is so high and it is exceeding 200, like over 120. But some of the patients, they can be developing of symptoms like headache, dizziness, vomiting. A lot of symptoms can be, but it can be also silent. So we have to take care about these things.
Okay, that's very important, which the information that you have shared, so that one has to be very careful because as you said, it's a silent killer, so you have to keep a regular checkup on your blood pressure.
As well, my advice for patients who are having diabetes mellitus and hyperlipidemia, they have to follow their blood pressures regularly, because there is a very high risk for the patients who are having diabetic and hyperlipidemia to develop a high blood pressure.
Okay, okay. Thank you, doctor. And dear viewers, it's time for a very short break. We'll be right back. Stay tuned.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Dear viewers, welcome once again, and we have in our studio Dr. Bushra, who is sharing some very important information on chronic diseases and hypertension. So Dr. Bushra, now moving ahead, we would like to know how can a person avoid to have high blood pressure?
Again, we have to look to the risk factors, avoid fats and salts on diet. Look for a healthy diet, increase your vegetables, take more fluids, do exercise at least 5 days a week. If you cannot, it can be every other day, at least for 20 to 30 minutes. Control your weight. If you are overweight or obese, try your best to decrease your weight. Control your stress. Stop smoking and alcohol.
Okay. So one should avoid all these things.
Yes.
And follow a healthy lifestyle.
Yes, you have to modify your lifestyle to control, to prevent to have a high blood pressures.
Yes, but sometimes the person cannot handle stress and tension and all those things. So what do you advise? How can they overcome all these things?
Now we have a lot of relaxation therapies, to have a yoga. Positive thinking is a very important, to be socialized. There is no excuse that we are having attention and stress, because everybody is having attention. So we have to look to ourselves that our health is very important.
Absolutely. Well said. Health is very important. So how we can treat hypertension?
First, lifestyle modification before any medications. Again, we are stressing on having a good healthy diet, exercise, stop smoking, stop alcohol, try to control your stress and be happy. Then we are coming to the medications, which I will not go in deep to speak about them, but there are 4 groups. The first groups, it is called diuretics. How it will work, that the kidney will take the extra salt and fluid from our body to be excreted from our body as a urine. But it have also a side effects when it is starting, like headache, dizziness, as well as increasing the uric acid. The second group, it is called the beta blockers. How does it work? It will release the stress hormones, which is the decreasing and controlling the blood pressures, but still they have a side effects. Again, it can have headache, dizziness, as well as slowing the heart rates and dry mouth with dry eyes. The third groups, it is called the calcium channel blockers, which they are blocking the entrance of the calcium to the heart and arteries. So it will keep the artery open and relaxed and not resistance the blood pressure, controlling the blood pressure. Again, it have a very important side effects, which can cause a swelling of the lower limb, as well palpitation. And the final groups, the 4th groups, it is called the renin-angiotensin system inhibitors.
Okay. So, doctor, we would like to know, is there any relation between hypertension and obesity?
Yes, there is a strong relations between obesities and overweight and developing of an obesity-related hypertensions, which is if there is obesity, there is increase about 65 to 78% to have a hypertension. So controlling weight is very important to be preventing to have a future increasing of hyper blood pressure.
Okay, okay. So one has to be very careful regarding their eating habits also.
Yes, because obesity again, it is related to the diets.
Absolutely.
Healthy diets, controlling weight and exercise. This is the 3 very main components which all the health centers and organizations, they are working in to be controlling all the chronic diseases, not only the hypertension.
Okay, okay. So now, before we conclude our today's episode, what advice or takeaway you would like to share with our viewers so that it can be a great help to them?
Prevention is better than cure. So be happy, smile so you can control your stress, think positively, lose weight, exercise, quit smoking and alcohol. You will be happy and healthy forever.
I'm sure our viewers will definitely follow what advice you have shared with them. And thank you, Dr. Bushra, for coming to our show and sharing such important details about chronic disease and hypertension. Really, we are really thankful to you.
Thank you very much.
Thank you. Dear viewers, it's never too late to take control of your blood pressure and improve your overall health. With this note, this is Meenakshi Sharma signing off for this evening. Until we meet next week, same day, same time. Take very good care of yourselves and your loved ones. Stay safe, stay happy, stay healthy. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.